Welcome everyone to our 6 Building Bridges webinar on person-centered thinking and charting the life course. I'm really excited for you all to hear from these two fabulous experts that we have, Tracy Mans and Barb Safaris, who are Ohio ambassadors for the Charting the Life course, with just amazing experience and information to share with you. They're going to spend more time. They told me they were going to introduce themselves, so I will let them get going with the webinar and enjoy.
Thank you, Andrea. I'm Barb Safaris. I'll let Tracy introduce herself first.
Good afternoon. I'm Tracy Mans. I am the project manager of the Family Resource Network of Ohio, which is the official hub for charting the life course in the state of Ohio. I am also the project manager for and aspirations lead parent facilitator for the aspirations group, and I'm an Ohio ambassador for charting the life course. And most importantly, I am the parent to 25-year-old Trey, who is a young man with autism.
Thanks, Tracy. Hi, everybody. My name is Barb Safaris. I'm from the Cleveland area. I live northeast of Cleveland. I retired from the Cuyahoga County Board. I worked there for 36 years and have been consulting for 10. So I've worked in the field for over 46 years. I started as a direct support professional, actually a sub, but I'm a trained speech language pathologist. I worked as an SSA, a service coordinator, and I had other administrative roles throughout my career, including training and onboarding staff. I have been a family caregiver. I supported my care partner for several years, but I'm also the big sister to Jim and Nick. So if you look at the Santa Claus picture, which I love, my youngest brother, Nick, was 4 years younger than me. He was diagnosed with a developmental disability when he was 6 months old, and I was 4, just going into kindergarten. And Jim, our middle brother, who was 2 years younger than me, was in an accident in his 30s, and that affected his ability to earn a living and to get through his day. And then in his 50s, he was diagnosed with a very, very rare syndrome. And so I have supported both my brothers, my mother, and my care partner through the medical system, the DD system. And for Jim, someone with an acquired disability, there wasn't a whole lot of support. But anyway, I am also a mentor trainer in the learning community for person-centered practices. So I'm really excited that you've asked about person-centered thinking and charting the life course. In an hour, we're going to do a quick introduction, and we talk about person-centered thinking, not necessarily person-centered planning, because we've realized after about 30 years that it really is about thinking. It's about a different way to have conversations, a different way to use language, a different way to interact with people, a different way to support people. And many of you, I hope you've attended some of our Charting the Life course sessions, and we'll talk about how you can learn more. But please know right away that person-centered thinking and Charting the Life course are complementary. And in this hour, we're going to talk very quickly about how in some healthcare settings, you might be able to use or recognize Charting the Life course as people, families, and professionals are using the tools to share information with you. We've sent handouts to Manisha, and you'll have them. We'll refer to them in the PowerPoint. We both work for the Family Resource Network of Ohio. Please go to our website, frnohio.org, because we have, when you go to the website, a pop-up will show and sign up for information, because anytime we offer a training or information session, they are free without cost. Most of them are on Zoom, and you'll get notifications. So if you're interested in learning more, sign up on our website. We also have a Facebook page, and we use it not only to get information out about when we share and have trainings, but also to share stories of how people with lived experience, families, and professionals across the lifespan from early childhood all the way up to aging are using charting the life course and the impact it's making on their lives. Of course, I said that our sessions are provided without cost, and that is because of our generous funding from the Department of Developmental Disabilities. So what we're trying to do in Ohio is share information, empower people, families, and professionals to use the framework of charting the life course, and that we build a common understandable language. You know, as family members, Tracy and I can probably tell you how many times we've heard the plans change or the language change, and we're like, what's that mean? What does that mean now? What's different from last year? So let me do some configuration of person-centered thinking and the intersection with charting the life course. When we talk about person-centered thinking, we're really talking about listening to people to hear and understand what they mean, not to react and offer a quick fix. We want people to have positive control over the life they want. We want them to be recognized in their communities as valued contributing members. And we want them to be supported through both paid and unpaid supports. And the reason for that is because we know all the help just cannot come from the system. You know, we need to look at the community and families. In charting the life course, and you'll see the medallion in the top left corner, that's kind of the medallion or symbol for charting the life course. Our core concept is we want everybody to have the right to live, love, work, play, learn, and pursue their life aspirations in their community. And let me just add, both person-centered thinking and charting the life course identifies community as whatever the person identifies, whether it is a neighborhood, a virtual community, a cultural community, an identity community. It's not just walking outside your front door. So wherever people feel they belong. The symbol in the top left corner is the symbol for the learning community for person-centered practices. So I'll use both symbols so you can kind of see how things really are interrelated and complementary. In person-centered thinking, we want people to get better lives, not just better paper. And I told you I was a speech pathologist. I worked for a county board, so I know we have to write paper, but what's on that paper is guided by person-centered thinking and charting the life course. Also in person-centered thinking, for probably 20 years, we've talked about knowing what's important to people and what's important for, and finding the balance. Important to being what people tell us, important for being what others say, family, professionals, healthcare professionals, counselors, the justice system. So when we talk about important to, let me clarify that this is not likes and preferences, which is what we've asked people for decades. These are things that have to be present in our life for us to have a good quality of life. If they are missing, they impact our life. And we talk about 8 areas. So people to be within relationships. And when we have conversations with people, we don't want to just hear family and friends. We want to hear names, because we don't like everybody in our family. We don't want to be with them, you know, so who's really important to us? The second area is one that piggybacks on, I believe, the last webinar we had, and that is looking at culture. You know, what's important to people about their culture and their identity? What gives them purpose and meaning? What gives them status and control? What are the things people want to do and places to go? What are their rituals and routines? We all have routines. We get up in the morning, we get ready, we go wherever we're going to go, we have our meals, we come back home, we transition back into our home, and then we get ready for bed. But in those routines, we have rituals. So do you use a specific toothpaste or a specific shampoo? Do you sit in the same place when you eat? And if somebody sits in your chair, you're like looking at them like, what are you doing? So rituals are very important to us, and they can tell us a lot about what's important to people. Rhythm and pace and things to have. Important too is what matters the most to people. So I'm going to go to a international learning community for person-centered practices next week. And I have my suitcase on the floor, and I'm trying to figure out how I'm going to pack my coffee maker, my coffee, and my thermal mug that Tracy gave us one year, so that I can have my coffee in the morning, not Starbucks, not whatever the hotel serves, but mine. So important too is what people tell us with their words and their actions. And in 47 years, I'm trying to think how long, 48 years of working with people with disabilities, I have yet to meet anyone who does not tell us what's important to them, and that someone in their life cannot tell us. So this is not just to be used with people who use words to communicate. And we always look at the behavior. So remember, we don't always use our words. If you had a bad day and you walk in the house and you slam the door, and somebody says, what's wrong? Your probably initial response is nothing. And if they say, you look like you're upset, I told you nothing's wrong. So our words don't always communicate. Important for is what other people say. And it's usually about health, safety, and what's necessary for people to be valued in their community. So as professionals, this is what we say, or even as family members. I don't want them to gain weight. I don't want them to be hospitalized, again. In-person centered practices, we make a set of promises. The first one is to listen, and to listen to hear and understand what the person means, not what we think. We make a promise to act on what we hear. And then we make a promise to be honest. So I told you Jim was diagnosed with a very rare disease. He was diagnosed at the Cleveland Clinic. 100 people in the United States had his syndrome or his disease. And I loved when we talked to the head of the department at the Cleveland Clinic, and he said to my brother, what do you want? And he said, I don't want to have this. And he said, I'm sorry. We've done research. We don't know why you have it. We don't know how to treat it. And we don't know what caused it. And Jim was like, he gave me no answers. And I said, he was honest with you. Then he asked Jim, what would you like to be able to do in your life? And he said, I want to be able to pick up my children. And he said, oh, you cannot lift more than a can of corn. And he goes, but I want to hold my children. And so the doctor took a few minutes and said, so let's think about that. You're 6'4". How old are your kids? And he said, how about if your kids stand on the back of the couch? That would put them probably at your height, and at least you could hold them like you would if you were lifting them up. And I have to laugh because he looked and he said, doctor, I live with my sister. It's her couch. I said, you could have your kids stand on the couch. But please listen to how powerful that interaction was. He listened. He heard what my brother said. He understood what he meant. And yet he took the time to say, let's see what we can come up with. Charting the Life Course is about having different conversations, excuse me. And it's not about using the tools. It's really about your framework and your approach. And it can be used with anyone. If someone doesn't talk, we get the information from people who know them. If someone is a baby, we get the information from the people who love that baby, their parents. So it's for anyone, regardless of age or ability. We have 8 principles in Charting the Life Course. I'm not going to define all of them, but just highlight that it's for all people. We recognize the family system, and we also recognize that the family may have different perspectives than the person receiving services, and that's okay. We honor and respect all perspectives. We believe everybody should have a vision of a good life and they should be able to work towards that life. We talk about life domains, not skill areas, but areas that we all talk about for quality of life, and that we all need support in 3 buckets. We need information, we need what will help us, goods and services, and we need to connect with other people who have similar experiences. We need to look at getting supports through several areas, not just the service system. And we want people and families to be involved at the, not only at the discussion, but the development of policy, procedures, and system change. So I'm going to turn it over to Tracy.
Thank you, Barb. So this slide titled "The Power of Words" is important to me because our words do convey our values and our beliefs, and we want to be careful in the words that we choose. So when we do choose words, when we're working with people with disabilities or even ourselves in our own lives, do we want to use words that convey a deficit versus a quality? Barb has the example, because she helped me put these together, of needy versus contributing. And a big one that we run across these days is independent versus interdependent. You would be surprised how many people with disabilities have felt an inordinate amount of pressure coming from the word independent, feeling like they need to do everything on their own and feeling like that's not possible. None of us are truly independent. We are interdependent upon our community, our jobs, our grocery store. I don't grow all my own food. I don't, raise farm animals and harvest. I'm interdependent on all those features. So helping people to understand those things. The question of what we're trying to communicate. Are we communicating needs versus supports to help people? And we think about what words could we use to communicate to others the value of people? And that leads me into one of my very favorite Charting the Life course tools. This is called the one-page person-centered description. You may have heard this called a portfolio, a one-page profile, a one-page person-centered profile, or the one-page profile. We don't use that word anymore. The word profile has, obviously developed a negative connotation now. So now it's a person-centered description. And the idea of utilizing this tool is to shift the narrative on the ways that people with disabilities are talked about and described. We want to go from that disability-based description to a person-centered or human description. We want to go from a needs-based description to support-based. We want to talk about who those people are and not what they do. An example of this would be when someone is introduced sometimes in an IEP meeting or to a doctor. In years past, they would say, this is little Johnny and he has autism and he has trouble paying attention and with self-regulation and he does all of blah, 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 negative. We would like to change that narrative and have it start out with, this is little Johnny. He's amazing. And these are the things that are important to him and the things that he likes. And oh, by the way, when you're working with him, he needs some extra support in these areas. And here's how you can do that. So just a big change in how it is. So each one-page person-centered description always will have at least 3 sections. We've shown you a sample of a form that's readily available to you. And I think we have those included in what we've sent to you. But you don't need to do it on a form. You could do it on a Word document. We'll show some examples later of some other ones. Those 3 sections, though, include what people like and admire about me, what is important to me, and how to best support me. We have a bullet here that says can also include a photo. I personally feel very strongly about including the photo. If you're ever utilizing this and you can include a photo, please do so, because it takes it from words on a paper to talking about a person. They become much more real when you can see who we're talking about. This introduces us to who that person is and tells us more information about them. The very first section is like and admire, and that is all about qualities. What qualities does that person have that people like and admire about them? It's not who they are, it is who they are, but not what they do. So when we talk about those qualities, we're thinking of things like artistic, helpful, friendly, kind, warm-hearted. What we're not going to say is the things that they do, that they play a musical instrument in the school band and that they're part of Special Olympics. That's a thing they do, not who they are. So often I find when we work with folks with developmental disabilities, they have a hard time sometimes thinking of those qualities. They're not the quickest things that come to mind. So we'll often provide them a list, and we're going to do that for you right now. And I'm going to ask you all to type in chat 1 or 2 qualities that people like and admire about you. We'll just give you a couple minutes for that.
Put it on safe drive mode.
Oh, thank you.
Here they all come. Fantastic. Polite, dependable, compassionate, easygoing, loyal, witty. Oh, look at them come in. Kind, trusting, creative. I love this. Thank you. Wonderful. All right. So the second thing is to consider what is important to me. And we think about our life domains as we go through that. So what's important to them? We want to consider, as Barb mentioned earlier, the relationships, the rituals, the routines, things to do, places to go, rhythm and pace. You can read all the rest of that on there. But when I think about what's important to me, I think that it is really important to delineate between that and what's important for me. So I will give you an example for my son. It's important to him to have time to himself to decompress at the end of a workday. It is important for him to take his medication every day. And when we have written these, because we've written them for many different situations, work for one, doctor's office visits for another, we have made sure to delineate that carefully. So when we're doing that and we're thinking about what's important to someone or ask them, we say, who are the people in their lives that are important? What to do and have? Where are the places that are important? The whens, the routines that we mentioned, and the why, because they do have a life that they value and they're a valued member of the community. So when we talk about important, thank you. So we're going to ask you to type in chat again, 1 or 2 things that are important to you. And please be detailed, not generic. When I did this with my son and he would say video games, I'd say, great, which video games? Tell me the ones. And so I'm going to ask you to give us some specific things that are important to you. Thank you, Priscilla. Cece, yeah. As I read through, these are all great. Time with family, time with my kids, unstructured, my son's yoga, nature, quiet time. Absolutely. I love it. You guys are getting all this. All right. And then this section's really important to me. They're all important, but this one is very specifically important to me. It's how to best support me. This is not advice. This is what other people need to do. Okay. It's not a description of needs, but literally what other people can do. So an example that Barb has here is actually one my son used a lot when he did his 1 page for work. When you're teaching me something new, tell me, show me, watch me, tell me how I'm doing. They need that feedback. Another example, follow the behavior support guidelines. Don't tell me what to do. Give me at least 2 choices. Remind me to wear my headphones in a noisy place. And it's written like that. The reason that we say, remind me to wear my headphones in a noisy place, what we don't want to write is, this person freaks out if it gets too noisy, because that's a negative. We're trying to do the action that someone can do to help support our person. Thank you. So one more time, let's type in chat 1 or 2 things that others need to do to support you at work or home. I'll give you an example for myself as you start writing them in there. Something that my family can do to support me when I come home is not immediately ask me what's for dinner the second I walk in the door. I have put the kibosh on that. They are not allowed to do that. I need to come in. I need to set my things down and take a deep breath before I have to answer your questions about food. Oh, good. Yeah, don't tell me too many things all at once. These are great. Thank you. Some alone time. Listen and hear me. Yes. Help with chores and dishes. Absolutely. Time between meetings. Wonderful. Don't just ask me verbally. Yeah, these are all good messages. Okay. Wonderful. Okay, so we're going to share some examples, but I do wonder if anybody has questions before we move along. All right, Barbara, I'm going to hand that back to you.
Okay, thanks, Tracy.
You're welcome.
Oh, thank you for your participation. Your
Yeah.
examples and your thoughts were awesome. And let me just remind you that the power of writing how to best support, most of the people we love have plans that are 20, 30, 40, 50, 60 pages long. And we depend on people who are making just barely above minimum wage, direct support providers. They're not going to be able to read and integrate that. But if we write down, this is the way you support me. You need to give me time when I first come home, or you need to remind me to wear headphones. That is so clear and so easy to understand by anyone. I wanted to show you an example of how to use a one-page description for maybe a reason we don't think about, but maybe as you're working with people, maybe you're working with caregivers that are tired, or for people who are duly diagnosed, and you just want them to think about what's important to you to be well. I shared with you that I was I took care of my partner. I was a care partner for several years. And so I developed this. I didn't share it on the paper, but I shared it in training, and I shared it with close friends, not the piece of paper, but what they could do to support me. And it was funny, you see under how to best support me, the last one is ask me if it's a good time. And every time Tracy would text me and say, can we talk today? She would always follow with, is this a good time? Or when is a good time? And so I just appreciated that she respected what was important to me and what would be helpful. We also recognize that with COVID, oh my goodness, and when people could not go to the hospital to be with their loved ones, that it was really important for people to think about writing a one-page person-centered description just in case their loved one was hospitalized. I'm going to show you several examples. I'm not going to read them, but I want you to see that they all have those three areas: like and admire, important to, and how to best support. They have photos, and they've been written for different reasons. A person can have several one-page person-centered descriptions. This is for Liam. Liam is obviously a toddler, and this is just for medical appointments. So how to best support. Liam has visual and auditory disabilities. So when you're going to do something, let him feel whatever it is. If you're going to check his heart rate or his heartbeat, let him touch the stethoscope. Let him put it in his ears. Let him listen to himself so he knows what's going to happen. For hospitalization, remember you're writing it for people who are working in the hospital. They want to be helpful. They want to make their patients comfortable. So keep it simple. The reason why we call it one page is because everybody will read one page. And for people who are in the hospital or at rehab, we suggest that you put the copy above the bed. Tape it above the bed, put it in a plastic sheet protector, and make sure the nurses have a couple copies, or you keep a couple copies. Don't just give it to the nurse to file, because it'll never be seen by anybody. And yet, how many people come in the hospital room? So think about what might be important to the person in the hospital. Tell me what's going on. Maybe, my brother could not change the channel. So it's like, he wants to watch TV. Introduce yourself. People made assumptions about my brother's ability to understand what was going on. For a child, it might be make sure they have their stuffy or their favorite blanket. If it falls on the floor and somebody reads, oh, it's important for them to have their blanket, they walk in and they see a blanket on the floor, they're going to be like, oh, let me give you back your favorite blanket. And it's a great way for people to start interactions with the patient. What others need to know or do, how to use the call button, what they might do if they're anxious, who to contact if they're anxious, how they express pain. And I'll give you some examples. So this is the example for hospitalization for my brother. You see that it says Nick the Greek. It doesn't say Nick Seferis because he liked to be called Nick the Greek. Look at important too, chatting with me every day and talking over decisions with me, and then a place to put my phone number. So no one's got to go look. Who the heck is that? Where's the phone number? Tell me who you are and what you're doing. And our Greek Orthodox religion, he wants to see the priest. How to best support him. Nick needed, in our DD jargon, total support. So he had to be fed, he had to be positioned, he had to be changed, he had to be bathed. So here's how to feed me, use a spoon. Whoever's feeding him doesn't need a 1 hour training on how to feed someone with cerebral palsy, because that would just teach you how to feed one person. But here's how to feed Nick. I can hear and understand you, don't yell. Nick used a laptop with voice output, but he couldn't use it when he was in the hospital because of the way he was positioned. So it was ask him yes, no questions. He can nod or move his eyebrows. Now, not everybody can answer yes, no questions, but please remember his sister was a licensed speech language pathologist. So I knew he could answer yes, no questions. How to put him in bed and he can't feel pain on the right side. That's critical in a hospital setting, because what's the first thing anybody asks? What's your pain level? 0 to 10. And I would be like, wait, that's only for his left side. He can't feel pain on his right side. And then how to best give him his medication. And I'm going to let Tracy share Tara's story.
Yeah, so my daughter Tara is a nurse here at a local hospital, and she works in a step down unit from the ICU. It's called a PCU unit. And one day, not too long ago, a person came up from the emergency room. She was a 40-year-old nonverbal autistic woman. She had fallen and knocked out all of her front teeth, broken her nose, and broken her eye socket. At the time, her parents lived 2 hours away. She lived in a group home here in the city, and she had a very exhausted caregiver with her because, as luck would have it, this terrible fall that she took happened right at the end of the caregiver shift. So she had come up from the ER. She had been given no pain meds, but, probably not shockingly, her behaviors were not what they'd like to see. So they gave her a large dose of ketamine, which is a tranquilizer, but she was still pretty uncomfortable. She had been zipped into a confining bed. It's a big bed that's got this mesh all around it that zips over her head because she kept trying to get out. She had not been cleaned up at all. She was still quite bloodied, and she was not wearing a stitch of clothing. So Tara called me, and she just took one look. Actually, she said, this won't do. She stepped out and she called me on the phone and she said, Mom, you've got something with this charting the life course stuff that I know you can help me. I said, I do. So I sent her a 1-page person-centered description and gave her a 5 minutes down and dirty on it. She had the advantage of being a sibling her whole life, so she innately understood a good part of it. And she went in and talked to the patient and the caregiver. So here's how it went. She went in and she said, first and foremost, let's give this woman some dignity. And she said, tell me why she's naked. And they said, well, when she doesn't like the way the gown feels. When she's in the bed and she's wiggling around, it gets tighter and tighter and tighter up on her neck. So she just keeps pulling it off. And so my daughter said, okay, what does she wear at home? And they said, well, she wears sweatpants and baggy sweatshirt. So no problem. My daughter went and got some scrubs for her. And then the provider had happened to grab a sweatshirt on the way out the door, lost the gown. Now she's got some clothes. Next question. Why has she not been given any pain meds? What's going on here? As Barb mentioned, she, being nonverbal, was unable to answer about the pain scale on from 0 to 10, right? So Tara said, tell me how she expresses pain. What does it look like? What does minor pain look like? What is major pain? I mean, we know with this kind of injury, she's got some serious pain. So they were able to get that assessed and get pain meds ordered and into her. Next question was, why did she try to get out of this bed? What's going on with this? Well, she was trying to get out of the bed, we found out, because at home, she doesn't sleep in a bed. She likes to sleep in a recliner. And it made her very aware that she was in the hospital when she was in a bed. So out went that hospital bed and in comes a recliner. So immediately, everybody's starting to feel a little bit better. So she went on to work through the 3 sections, a little bit more detail. They talked about her and who she was. What did people like and admire about her? What was great? They talked about what was important to her. What TV shows did she want on the TV? Did she want to color while she was there or paint? Did they want the bird team to come in and help assess and figure out what was going on? And then how to best support her. All those things that we just learned about her went on there and on that chart. So what happened? They put that paper on the wall above her bed. And here are the results. So the patient, of course, was much better cared for and much happier. Our caregiver, who was worn to a frazzle, felt like she was able to step out of the room, get some food, get a cup of coffee, because all that information that was there that she needed to convey was available readily to folks. The nursing staff loved it because the information that they would see on the chart is that this is a 40-year-old nonverbal autistic. That means nothing to them. That didn't tell them anything about how to care for her. And the doctors on rounds were loving it because the next morning, one of the doctors came in, saw it there, and he read it and he said, this is amazing. I have all the information I need about this person on the chart medically. But this, so tell me who it is. He said, why don't we have this for everyone? And then I think the one thing I want to, add to this is when that patient came to the hospital, a 2 to 3 inch 3-ring binder was included. That was the caregiver grabbed it. It was all full of care instructions and information, and it went to the emergency room and it was unopened, and it went up to the floor and it was unopened because nobody has time to stop and read all that information. But everybody who entered that room stopped and read that one page, and it changed both her life and the care staff and the provider's life immensely.
Thanks.
You're
Thank you,
welcome.
Tracy. Thank you so much. I also just want to remind you that we know that doctors can't get training and therapists on every disability, every configuration. Tracy and I have both worked with work groups that include doctors and nurses, and they just don't get the training. And so we see this as a way to either frame the conversation and ask people, what do I need to know? How can I best support you? What's important to you when you come to see me in the office or for therapy or whatever? And also to help families write this, because families will often say, but I keep a bedside vigil. Well, I kept a bedside vigil with 2 brothers, my mother, and my partner. And there are times when you have to go to the bathroom. I mean, I'm just going to be blunt. And the one time when my partner was in the hospital, I waited all day for that doctor to make rounds. And the one time I left to go to the bathroom, I came back and he said, oh, the doctor just came. And I flew out of the room and said, where is the doctor? I want to see him. Because my partner had some issues with memory and could not tell me what the doctor said. All he could say was, we had a great conversation. He's a nice guy. That's not what I need to hear. So think about how you might perhaps encourage people to develop a one page, or how you might use the one page as a frame to have conversation and organize information. Again, just to show you some examples, I love this because it shows you Sam, but he's with his two daughters who you're supposed to call if he has any concerns. But look at this, he has a feeding tube. Distract him when assisting with the feeding tube. Talk about feeding birds or growing plants. How to keep him calm and how to assure him. Martin receives supports from both the DD system and the mental health. If he's upset, ask him if he wants to talk to Mario. Ignore his speech impediment, talk with him as a peer. Ask, don't order. Tell him what will happen before it happens, explain it to him. And no lectures. Jim wrote his, so he uses the I pronoun because he wrote it. I'm a smoker, I may need a nicotine patch. If I get depressed, or if I get, it says down in the dumps, sorry. Talk to me about stuff I've done. I live in my own apartment. I have a job I love. I'm engaged and I'm great at sports. So right there, how to engage with him, how to calm him down, how to support him, how to make him feel good about himself. So one of the tools in charting the life course is a trajectory, which is just an arrow towards what we want and an arrow towards what we don't want. We want people to use the one-page person-centered description. We want it to be human-centric, who this human being is that as families we love and care about. What are their qualities? What do other people need to do so that they can act? Not so that they can go, oh my God, look at the disabilities. How are we going to deal with this? And it's developed for a purpose. So if it's developed for school, it's going to look different than if it's developed for a medical appointment. And it's developed by the person and the family and the people who know them best. What we believe is that a one page is a great way to introduce. It's a quick summary. We've presented this to people working in with people who are in both systems, DD and mental health. And the therapists have said, oh my gosh, I'm going to do this with everybody I support, because what a great way to build self-esteem, to have people talk about who they are and how other people can help them. And then if you're working with teenagers or students in that transition age, you know that part of the IEP is they have to start identifying accommodations. What's best? How can you best support me? So it also empowers people to start thinking about, what do I want other people to do? I often, sometimes people say, oh, it's hard to get that information. And the way I frame it with families is, if I'm walking in your house and I'm going to be supporting your loved one, in 2 minutes, tell me what I absolutely need to know. And people know that. Families know that, and they come up with it very quickly. So like I said, you can use this in many different settings. Someone can have several. I've even seen it used by families to introduce their loved one to their extended family before they attended a family reunion. Here's a little bit about our 3-year-old son who was just diagnosed on the autism spectrum, because they didn't want the family to be afraid of him. And so it was things like, if I kick a ball towards you, it means I want to play, just throw the ball back to me. And they included pictures of characters he likes. So Barney and Thomas the Tank, I think that's right. And so people seeing that would be like, oh, so you love Barney. I do too. I watch it, or whatever. And it's a great way to engage. I told you we talk about life domains in charting the life course, not skill areas, because I don't walk around and tell my friends that I brush my teeth 3 times a day. I talk about what I do during the day, my daily life, where I live, who I hang out with, what I do for fun, and also my spiritual life. I might talk about healthy living, oh, I'm watching, or I'm going to the gym, or I actually had to review someone's work, and I checked it as I was just getting ready to go to the gym. And so I left a video message and I said, first of all, I'm just going to tell you, I'm on my way to the gym. So this is the way I look, but I watched your video and I want to give you feedback. Safety and security, not just the old health and safety like we've assessed in the past, but how safe do people feel in their neighborhood? Do they know what to do if the power goes out, or if there's a thunderstorm? We had bad thunderstorms the other night. Do they have help with making decisions? And then advocacy and engagement. We all do that. We vote, we speak up, or we ask someone to go with us to a medical appointment so they can hear the story also and support us. So these are quality of life areas, and we want people to have the life they want. Looking at these 6 domains, they are relevant across the lifespan. So, people will tell me, oh, I have a 2-year-old, I'm not looking at employment. Yeah, but you're teaching them routines, you're teaching them structure, you're giving them chores. They're learning that before you go to bed, you put your pajamas on, you brush your teeth, and you get a story and a glass of water. You're teaching them routines. Those are important for daily life and employment because you're teaching them structure and predictability. So I want to just quickly share with you what's involved with healthy living across the lifespan. So some of the things to consider for school age, do they know their needs? Can they express them? Are they using technology? Are they getting exercise, and how are they getting it? For 14 to 22, are we helping them be able to converse with their healthcare providers? Are we helping them learn about their own health needs? And are we helping them prepare for medical appointments? Do they know who they can talk to? I just had a friend tell me that a relative's daughter who's in her 30s is in the hospital with sepsis because she has diabetes and didn't realize she stepped on glass. Oh my gosh. And we were just like, oh my, she didn't tell her parents. She didn't know. Oh my gosh. So do they know who to talk to? Do they know who they can trust? For adults, 22, are we helping them understand their health insurance? Are we helping them understand the medications they take and why? Are we helping them get proactive medical checkups? Are we helping them talk at the medical appointments? I have to share, I shared that Jim lived with me for, I don't know, 10, 11, 12 years. And I went to every medical appointment, even when I didn't live with him. And I would always take a notebook and I would always take notes. And when we went to one doctor at the Cleveland Clinic that was new, she walked in, she said, Mr. Saparis, please tell me how to say your name. I'm Dr. So-and-so, shook his hand. She turned to me and she said, oh, you're the sister who takes notes. I said, how do you know that? And she said, you're in my chart. So his doctors knew that I attended his appointments with him. I had his permission and I was taking notes. And she said, please don't be offended. I'm thrilled that you're here because we as doctors have to tell our patients things and they don't remember, they're stressed, they hear something, and we're thrilled that you come and take notes. So as perhaps as Jim's doctor, what do you want, Jim? What do you want to be able to do with your kids? As you think about how to best support people in their appointments or in their ongoing treatment or whatever, think about these life domains. Here's something called a vision tool. In charting the life course, we like to use icons to help people because not everybody we work with is literate. So the first column is an icon for daily life and employment, which is a calendar, a little bit of a description, and then a place to write. So when Tracy and I work with people and families, we tell them, think about what you want them to be able to do during the day. Write it down. When we talk to people who receive supports, I've had people draw, I've had them write, I've had someone scribe for them. And this tool is, I believe we put it in the packet, but it's on lifecoursetools.com. And then go to the heading that says foundational, and then go to person perspective, and you'll see the vision. The person can fill this out, mom can fill it out, dad can fill it out. And then if you're working in a team, you can get multiple perspectives and see where there's mutual focus and start working on those. And maybe if there are differences, you can have further conversations to clarify. This is an exploring trajectory, just asking people, what do you want in your life? What don't you want? So I've worked with people who are involved with the mental health system, and they have said, what I want is not to go to the hospital so many times in the year. I want to take fewer medications. I want to feel better about myself. And that's the hook to, you need to make sure you take your medications. How can we support you so you do that? You said you don't want to take more, so how do we make sure you're taking the ones you take? And we provide the support based on what they've said to us, is their vision or what's important to them. So please remember, whenever we talk about charting the life course, we always talk about the person, but always in the context of family, whether that family is biological or chosen. That we talk about 6 life domains or 6 areas that define all of our quality of life, lives, whatever. And we all have 3 areas of need, whether it's a medical need, a system provided need, or whether it's something like planning a vacation. We need information. We need to know what goods and services can help us. You know, what hotels, are we going to fly? Are we going to drive? Are we going to rent a car? What are we going to do? We're going to stay in an Airbnb, and connecting with others with similar experience. So who's gone there? What can you tell me about it? We didn't talk today, but one of the principles is we need to look beyond the service system and see what supports are out there from people they know, their own personal strengths, technology, and what's out there for anybody that lives in the community. It's important to have a vision of a good life across the lifespan. It's never too early, it's never too late. And to be able to work towards your good life and have that support. Some of the things that are coming up from the Family Resource Network of Ohio, on July 26th, we have a community of practice meeting. We meet quarterly, and it's a time for people to come together. And as with any community of practice, we're all passionate about supporting and empowering people and families, but we want to share what you're doing. So it's an opportunity to hear stories of what people are doing, but then also to get in small groups and talk with each other about what are you doing? How are you using Charting the Life Course? We have lunch with LifeCourse on the 27th of July and August 3rd, and we're going to talk about respite as a break from caregiving, not the paid waiver service, but why it's important for caregivers to take a break from caregiving and how you can help them think about what would be good respite and how can I plan for it. We also provide guided implementation for staff, for professionals, and for people with lived experience. Those are coming up in the fall, where we take people through actually using the tools and resources and actually filling them out while they're on the Zoom call. So please go to our website. Please like our Facebook page so you can see the stories of how people are using Charting the Life Course. Here's the website that has, oh gosh, it has so many resources. You probably would need hours to look at them all. And we want to thank our partners, the DD Council, the Department of DD, the Family Resource Network, and of course our National Nexus team, LifeCourseTools.com. We'll open it up if you have any questions, and we ask you, we are grant funded. So if you would be so kind as to go use the code and fill out 2 or 3 questions. We would appreciate your feedback. And we are happy to answer any question. I'm going to leave this up, but does anybody have any questions?
If you don't have questions, I wonder if you have any comments about what you heard today.
Can you think of any ways you might use or encourage or empower or any of the tools?
I can chime in. I'll comment. So we were lucky enough to have an ambassador be a part of our evaluation clinics. And so we started, it's been a process for us integrating these tools, but they're fabulous to just have conversations with families, whether we're giving first-time diagnoses or they're in such a way that we can have the conversation with the family, with the individual, and it really puts things into concrete ways. We have overwhelmed families or non-overwhelmed families. So I think these are great. And the one-page summary is something that I think is just invaluable. I was sitting here thinking we need to do this at the beginning of all of our clinic appointments, is have people fill it out. But
Yes.
thank you.
Absolutely. That's awesome. Thank you. And, families, what families say to us is it was really, at first it was overwhelming, but once I wrote stuff down and had it on paper, I felt like I had power and control. It gave me paper power and paper courage. I wrote it down and now I could share it with whoever was helping them, whether it was the school, the board, a counselor, a therapist, a physician. And so there's paper in helping people organize their thoughts in paper. There's power in helping people organize their thoughts and put it on paper that they can
Barbara,
share.
do you see
Yes.
Zachary has a great question in chat. How might you balance this when there are behavioral concerns that caregivers, practitioners need to be immediately aware of, but aren't very positive?
Awesome question, Zachary. As a speech pathologist, my area of expertise was working with people who didn't use words to communicate and identifying how to best support instead of saying they throw tantrums, they hit, they spit. It was when there's going to be a change, give them the information using visual symbols, or when you see them start to get agitated, ask them if they want to break or if they want to sit and talk. And so it is directive to what you need to do. And I have had behavior intervention specialists say that when they write it that way, they can almost get rid of the intense behavioral supports, because people are proactive and they know what to do versus what to do when something blows up. I really love the way you talked about reframing.
Yeah.
I worked as an RBT for 2 years. Yes, it is. It's, in fact, one parent just said she developed a one-page to share with her ABA staff. Oh, there's 2 surveys. Okay.
Yep, I just was going to ask everyone for the Building Bridges project. We're going to have 2 little surveys today, everybody, but that one helps us just to be able to track what's going on so that we can be accountable to our funders too. So that link is in the chat.
Awesome. Any other questions? Thank you so much. Thank you for participating. Thank you for typing in chat and being interactive. And thank you for the questions. Anything else? Well, Andrea, thank you.
Yes, thank you.
And I just want to thank you both. I think this is helpful. You can see from the comments that people are seeing how this can be helpful for everyone, but especially our folks that have the co-occurring mental health considerations. And I think we're seeing kids, people just across the board. So thank you so much. We really appreciate it. We'll have those resources. We emailed them out to all of you. If you didn't get them, you can email Manisha, but you should have access to all of those resources. We will be recording this. Our website should go live soon. I know Manisha's been sending out the recording links through YouTube, but we'll have those resources out for you. This is our last in the webinar series. We will be doing a learning community starting in the fall, and we will be sure to send that out to all of you. And thank you again, Barb and Tracy. Fabulous.
Thank you.
Thank you.
Appreciate you having us. Take care.